Hello, everyone. Welcome to the Collaborative Family Healthcare Association's Call for Presentations 2016 Instructional Webinar. I'm Polly Kurtz, and I am the Executive Director of CFHA. We'd like to thank you all for being on the call today. Just a little housekeeping before we get started. I wanted to let you know that throughout the course of this webinar, you will all be muted. We'll have some time for Q&A at the end of the webinar, and at that point, if you would like to ask a question, there are a couple of different ways to do it. One is in the navigation bar on the right-hand side of your screen. Next to your name, you'll see a little green hand. If you want to raise your hand and ask a verbal question, I can unmute you and you're welcome to ask the question in that way. Otherwise, there is a field in that navigation bar called questions, and you can type in questions at any time throughout the broadcast, and I would be happy to answer them at the end. So I'd like to just go ahead and get started. This year, our conference will be held in Charlotte, North Carolina, October 13th through 15th, 2016. As you know, the theme of this year's conference is celebrating the many faces and places of integration. Our goal with this year's conference is to celebrate the blend of emerging models and the continued evolution of current best practices in integrated care with a focus on quality and fidelity. Participants in this year's conference will have an opportunity to exchange ideas and learn from the leaders of integrated behavioral healthcare practice, training, research, and policy, and share exciting new innovations. We're really hoping this year to bring in the scope of integrated care practices, both in terms of models and methods, but also in terms of different places of practice, types of practice, multidisciplinary providers, and with all of it in a strong focus on patient and family-centered care, as well as being supported by evidence. So we are currently in the process of our call for presentations. The presentations themselves opened on February 1st, and the website portal will remain open until March 14th. A couple things to note: you can reach the proposal form at CFHA.net, and I'll walk you through that form a little bit later in this broadcast. One thing to note, this year a separate call for posters will be run, so call for presentations that are not accepted for presentation. In past years, they have automatically rolled to the possibility of a call for posters. That will not occur this year. If you are interested in having a presentation considered for a poster as well, we'll ask that you submit both for the call for presentations and again for the call for posters. The actual call will be just a little bit different for the call for posters, so be sure to keep that in mind as you go through the form and your consideration for how you would like to disseminate your research or program evaluation information. Let me tell you just a little bit about our conference. This is CFHA's 18th annual conference. It is a 3-day event. This year we're expanding the program a bit, and it will start on Thursday afternoon. Typically it started around 4 p.m. This year we will start about 2 p.m. With the regular program, and pre-conferences will occur earlier in that morning. We will have we're expecting over 500 registrants. Last year in Portland, we had close to 550, and our conference chair and planning committee has assured me that we should beat that number, but a safe number and expectation is about 500. Disciplines represented include all variety of family practice physicians, psychiatrists, psychologists, social workers, LPCs, the whole ilk of behavioral health providers, as well as many administrators of healthcare services. Our conference is the premier conference on patient and family-centered integrated behavioral health care. We're quite proud of its legacy and the work that we have accomplished. In the conference, we'll offer this year over 60 breakout sessions. Friday and Saturday will be the breakouts. Up to 9 sessions may run concurrently. Our breakout sessions this year, for those of you who have presented in the past, know that we have had up to 90-minute sessions. This year we are organizing the program with the longest sessions to be 60 minutes. We'll have some 45-minute breakouts, and then there is a possibility for 2 breakouts to run concurrently in that 60-minute block, so we may have 25-minute sessions. And so you will, as you fill out the application or the proposal, you will have the option of picking which time best fits your proposal. So a couple of things before you get started. It is very important for each of the submissions to identify a primary contact person. That will basically be CFHA's liaison to the rest of your presentation team. That primary contact person will receive all correspondence related to the proposal and will be required to communicate this correspondence with all of the co-presenters. Another thing to note before you get started, all presenters are required to register for the conference. There are no complimentary registrations, at least associated with acceptance for a breakout session. We've had some confusion over that in the past, so make sure if you are the primary contact person for your presentation, you have agreement from each of the people on your presentation panel that they will agree to register for the conference before submitting that proposal. All presenters are also required to disclose any, I apologize for the typo there, to disclose any commercial conflict of interest upon acceptance, and they will also be required to submit a CV or resume upon acceptance. And then finally, proposals that are not accepted for presentation may be accepted for a discussion group or a 25-minute session. You'll have an option to, on the call for proposals, to select if you are willing to have your proposal considered for either a 25-minute session or a discussion group. Again, proposals will not automatically be considered for a poster presentation. You must submit a separate proposal to be considered for a poster. Let's talk a little bit about what is required for the online form and process. We would like to encourage all folks who are considering submitting a proposal to make sure and gather all of the information needed prior to tackling the online form. It's good to review the form, be familiar with it, but we'd encourage you to gather all of this information, put it in a Word document in plain text, and then at the time you launch the form or get started, you'll have it all right there in front of you. There are some issues, as we'll talk about in a little bit, with the form timing out. If you take too long to fill it in, it also doesn't enable you to save the form and come back at a later time. So the online form is very finicky, and we want to keep this as easy as possible for our submitters. So again, I'd encourage you to gather all of this information out of the gate. The things that you'll need to get started, again, identifying the primary contact person, You'll need a title for your presentation, ideally something that's quite interesting and attention-grabbing. A brief summary. This will be a 3 to 5 sentence description about the presentation. This description will be what is included in the conference program, on our website, in all of our marketing materials. A couple of notes about this. Make sure that this 3 to 5 sentence description doesn't have spelling errors, does not have symbols or other icons in it, because we basically pull directly from what you input into the form and put it in our program. Although we try to edit out some of the little weirdnesses, it's important for it to be clean copy when you enter this. The third thing, or the fourth thing, is we'll need you to identify one of the 6 conference tracks most applicable to the presentation. In our review process, we sort by those tracks and sort by the scores of the reviewers, so it's important to do that. We'll talk a bit more about what each of those tracks contain in a few minutes. And then a brief abstract or outline of your presentation's rationale, format, and evidence support. So this brief abstract and outline is actually what the reviewers will use to get a full picture of your presentation, the evidence that supports it, how you plan to format the presentation in terms of audience participation, etc. And this is really the best broad picture of your presentation. Again, this will not be used in any way for conference marketing, but you'll want to really attend to this because this is what the reviewers pay attention to. Presentation content. In the application, we'll ask you to identify whether your presentation is basic, i.e. core concepts to expand the knowledge base in integrated care, or advanced, intended for practitioners or providers with 5+ years of integrated care experience. What we're finding at the CFHA conference is we have many folks who are brand new to the field and really just looking for basic knowledge in both clinical skills and how to set up integrated practices. So although we have evolved as a field significantly in the past 20 years, we still want to make sure we have a good piece of our conference presentation that focuses on this kind of nuts and bolts basic skills. So we want to encourage everyone to not only consider the more advanced presentations, but also if you have good evidence and support to support a basic level implementation kind of presentation, we'd encourage you to submit that as well. We'll ask you, as I mentioned previously, to identify the minimum session length necessary to deliver the content. And then for each session, we will ask that you identify 3 behavioral learning objectives. These are needed for our continuing education, both for physicians and behavioral health professionals, nurses, etc. Along with those behavioral health learning objectives, each presentation must be supported by 5 references that are no older than 5 years old. So we're trying to keep the information disseminated as current as possible. Again, both of these are requirements for the session to receive CEU credits. If they're not present, they will not be considered for CEs. And finally, the presenters at the conference, and we'll talk about this, we're very interested in multidisciplinary panels of presenters that include a combination of behavioral health professionals and or folks that represent the medical field, i.e. nurses, pharmacists, physicians, etc. Multidisciplinary teams that also include community representatives or administrators are also highly encouraged. We'll talk about what needs to happen for each, or how we need you all to reference each person's professional name, because we'll pull that for the conference programming. So I want to talk a little bit about what we are encouraging outside of the specific tracks. We are very interested this year in proposals that reflect all of the different integrated care models. For example, the PCBH model, SBIRT, bidirectional integration, the impact model, or any other programmatic variation of those, or something perhaps we haven't heard of before. We want a nice sampling across all different models and don't want to be too heavy in one or the other. In addition, we're very interested in proposals that focus on special populations or settings. For example, specialty or tertiary care, school-based integrated settings, pediatrics, geriatrics, etc. So we definitely want the expanse, not only just primary care settings, but beyond. We're also very interested, as I just mentioned, in proposals with multidisciplinary partners, both medical and physical health partners, along with behavioral partners. You will have an opportunity in the application itself to identify the mix of partners and presenters that you have for the presentation, and we'll talk about that and show you that in just a little bit. Connection to evidence. This is a huge one for us. We are committed to quality programming that supports the current evidence base or builds upon rigorous program evaluation and research. You will have an opportunity to actually make a specific statement and talk about the research that supports your particular program in the application. And then finally, as is our legacy and CFHA's history, we are very, very interested in family-centered approaches to care. We believe that they improve health by building on relational resources and addressing problematic relational dynamics. You will have an opportunity in the application to address how your proposal includes and is centered on patient and family care. So let's talk just a little bit about the tracks. This year, CFHA has 6 specific tracks, and we will ask you to identify one of the 6. The first is a focus on patient and family-centered approaches to care. Please note that as I'm going through these, I'm going to do a relatively brief overview, but you can find full descriptions both on our website in the application itself, and there's a PDF that you can download that has a full description of each of these tracks. So again, the first is focus on patient and or family-centered approaches to care. We're looking at strategies, practices, and tools proven to be effective in expanding roles for patient and family members to better manage their own health in primary, specialty, and tertiary settings. We are also looking at family-centered approaches to care in partnership with underserved communities that focus on planning, implementing, and evaluating programs that reduce disparities in healthcare. So in many cases, this may apply. Again, we want that family-centered focus across all of the tracks, but if your particular presentation is specifically focused on family and patient-centered care, we'd encourage you to pick this particular track. The second track is our clinical skills and innovations in team-based care. Within this track, we're looking for presentations that focus on skills building training for providers, again, based on evidence-based prevention, treatment, and care management practices. We really some of our most popular sessions are practical applications of clinical skills. Those are typically highly rated both in presentation and by our peer review teams. So we're particularly interested in proposals that address that practical application of clinical skills. Innovations. That area may not have as much evidence supporting it, but we really want to hear what people are trying that's new and interesting in the field, inspiring, and then finally implementing care process models. Those care paths, we'd like to be able to share that information. As I mentioned earlier, we have a whole spectrum of conference attendees, from folks who are very, very new to the field to, seasoned practitioners and researchers. So we want to be able to cover the gamut, and particularly this clinical skills and innovations track. We're hoping to be able to do that within that track. The third track is population and public health. In this track, we're looking for collaborative strategies aimed at the prevention and early intervention of substance abuse, physical and mental health problems. Some examples of that include smoking cessation, healthy eating, exercise, etc. We're also looking at any multi-sector partnerships that support the provision of integrated care, system transformation kinds of efforts, and any other population health efforts and or policy efforts that promote the greater adoption and sustainability of integrated care. Our fourth track is financial sustainability and cost control. We recognize that there are a number of initiatives and innovative strategies occurring across the U.S. that support this model of care. We're interested in hearing from folks in those states or regions that have successfully established programs that are making this work possible. Workforce development and interprofessional education. This really is about training people to do this work, how to train people to do this work. So interprofessional training approaches, workforce training. What we know is that we have a very limited trained workforce in integrated care, and we really want to give people an opportunity to learn how to train others. And then finally, our last track, and this one I'd like to draw special attention to because we've had some confusion over this in prior years, training in research and evaluation. In this track, the thing that we're not looking for is a dissemination of research and or program evaluation findings. What we are looking for are presentations that actually provide beginner or intermediate level technical training to professionals interested in initiating and facilitating rigorous quality improvement, program evaluation, or research projects. We are looking to train people in this track on how to do effective research and how to do effective program evaluation. I will show you momentarily in the actual application or the proposal form. This track is outlined at length in a PDF document. If you're considering applying for this track, I would highly encourage you to spend a good bit of time reviewing that document and making sure that your presentation fits this track. So about the submission process, let's talk about that for a moment. It is an online form. We've revised it this year to be broken out in 13 separate sections. All sections must be completed in their entirety before you can submit. So unfortunately, the back end of our software does not allow us the functionality to have you fill out part of the form, save it, and come back later. It needs to be done in one sitting. There's also a timer mechanism on it so that if you have it up, step away, and you can possibly time out and have to start all over again. The form will not transmit without all of the required fields. The required fields are identified with an asterisk. Plain text is how we need you to enter the content. No symbols or formatting. It ends up just looking like junk at the back end when we download your proposal for review. Characters and symbols do not translate. Again, particularly for that brief 3 to 5 sentence description of your proposal, it's very, very important that you don't include symbols or formatting nuances in that description. If your form is submitted successfully, you will receive a thank you page message. If you don't receive that thank you page message, it means your form wasn't submitted successfully, and all you need to do is scroll to the top of the form page. We'll look at that in just a second, and it will give you notifications about what's missing or incorrect. Let's talk a little bit about deadlines. So the CFP is currently open and will be open until March 14th. That should be 2016, not 206. That will be our deadline. We'd encourage you, and I'll talk about this a little bit more, don't wait until the last 2 or 3 days to submit. Sometimes the traffic is so heavy during those last few days before a submission deadline that people end up getting kicked out, and it's just more troublesome to submit. So we'd highly encourage you to shoot for the week or two before that deadline. In March and April 2016, our peer review committee of conference planners, board members, and folks from our research committee will be reviewing all of the proposals. Last year, we had approximately 180 proposals, and we had 72 accepted for the breakout session, and we anticipate a fairly competitive process again this year. As I mentioned previously, we will run a separate call for posters this year. It will occur between April 1st to May 6th, 2016. If you would like to be considered for a poster, we recognize that you will not know at that point whether you've been accepted for a presentation, but we want to encourage you, if you want that as a default, go ahead and submit as a poster. If it ends up that you are accepted for a presentation, we'll automatically take you out of the poster list for consideration. In May, our conference leaders will make final selections and schedule presentations for the conference. You should know by May 31st, we will notify the primary contact person regarding the status of your proposal. And then our conference registration opens on June 15th. If you are accepted, we would encourage you to consider registering for the conference fairly early after that registration opens. Last year, we were very close to a sellout situation in Portland, and we want to make sure that if you are accepted for presentation, you're registered for the conference. So let's now just take a moment and take a look at our actual call for presentations. You should be able to find, if you log on to the CFHA website, which again is www.cfha.net, and go to the conference tab, 2016 conference in Charlotte, and toggle over to the call for presentations, it will take you to this page. Basically, everything that I have described in this webinar is outlined in narrative on the page. You can also print out on this page a PDF copy of the call for proposals if that's a little bit easier for you to navigate. So the first part of this page basically talks about the conference theme, about CFHA and our annual conference, As I talked about earlier, the elements that we are encouraging and will weigh more heavily in the selection process. Again, medical collaborators having multidisciplinary presentation teams, a high connection to evidence, and then family-centered approaches to care. You'll see that the full description of the 6 tracks there. The general submission agreement, I would encourage you as both the, if you are draw the short straw and get to be the primary contact person, make sure that you spend a considerable amount of time looking at that submission agreement and making sure that each of your co-presenters has fully reviewed that submission agreement prior to pushing the submit button. We'll talk a little bit after we go through the form about troubleshooting tips. But then you'll see at the bottom of the form are our 13 sections for this year's proposal process. As you can see, they are numbered 1 through 13 across the top of the page. The little icon will show black as the page you're on. Once you have completed the page, the number will turn red, meaning, will turn green, meaning that you have fully completed the form. And if you've not fully completed it, you'll get a little red dot on it saying they're missing or invalid required information. Unvisited, of course, is blank. So first page basically just walks us through instructions for the form. It's pretty self-explanatory. At the bottom of each section, you will just hit a next button. As you can see, it takes us to the second page of the form, which is the primary contact information. Fairly straightforward. Once that's filled in completely, you will get, it will turn green. The third page, and as you can see, because I haven't filled out page 2, it's indicating that there's missing or invalid required information. And you can see what information is missing in the second form. So it's pretty self-explanatory. The presentation details for marketing. Again, we will have the title that will pull directly for our conference programming, and the summary. Again, this is a brief description that conveys the essence of the presentation. This needs to be plain text, again, without formatting or symbols. There's a limit of 500 characters on the presentation details. Page 4, conference tracks. Again, please pick one of the 6 identified earlier. I do want to make mention on this training and research evaluation. I'm afraid I bypassed this earlier. You'll see above on the form when we're describing each of the tracks in this training and research evaluation, at the end of the page, you can click for a more detailed description of the criteria in track 6. Again, if you are considering choosing track 6, we highly encourage you to click, print this out, and take a good look at what is required for that. Number 5, connection to evidence. Again, this is very important to us as we build a conference program that is quality programming that supports our current evidence base and builds upon rigorous program evaluation and research. You will have 4 options, actually 5 options to choose from. The first, and if this fits your presentation, select the one that most closely matches your presentation. It's a demonstration program with clinical training or system transformation strategy based on existing evidence-based intervention. It's a demonstration program, clinical training or system transformation strategy with pilot data. It's a pilot program, is C, with rigorous evaluation data. Or D, it is a well-controlled research study that builds upon literature. Now, we recognize that in some cases, particularly as it might relate to policy presentations or innovative statewide strategies or other things, we or you may not have strong connection to evidence at the point where you are submitting for this presentation. In that case, we encourage you to check E, not applicable. If you do check E, please explain your answer. You'll see there's a narrative box that gives you an opportunity to provide some more information. And really with A through D, we'd also like to have you provide just a little more narrative explaining why you chose the one you did. This is a new element this year. We recognize it may be a little problematic for some, but we're hoping to build upon it and improve it for future years. So this is our pilot year with this question. Again, part 5, which is number 6, family-centered approaches to care. As I mentioned, family-centered approaches improve health by building on relational resources and addressing problematic relational dynamics. We want a narrative statement about how you are engaging and partnering with families, couples, and other close relationships, and whether that is a part of this proposal. Number 7, or part 6, partners and collaboration. This is your opportunity to show us how and who is part of your presentation team or who has been a part of gathering the data and or program evaluation that feeds into the presentation. You'll have an opportunity to check as many of these as apply or list other medical providers. Presentation content and considerations. So content level, 7A goes back to what I was talking about earlier. Please indicate whether this is a basic presentation for folks new to the field or advanced for those who have 5 or plus years of experience, or if it's intended for all audiences. And then in session length, a couple things to note. You'll have an opportunity to select either a 45-minute session or a 60-minute session. If you are interested in an alternate format, you can select either a 25-minute session or a discussion group. If you do not, if you are not interested in a 25-minute session or a discussion group, please do not select one of those, and then that way you won't be offered that. Audience interaction. Last year, one of the pieces of feedback we had in our wrap-up and in our conference evaluation was that people wanted to know, those attending the breakout sessions, what the format was, how much audience participation there was going to be, what that participation was going to look like, how it was going to be broken up. So please indicate how you intend to involve your audience participants in this section. Section 10 is the part where you get to really be expansive about your presentation and what's included. This is basically the meat of it that the reviewers will use in evaluating your presentation. What to include, as I said, the methods or results for presentations that include empirical data from quality improvement, program evaluation, research. we would like you to include information on the sample, size, basic demographics, procedures, summary, etc. Really, the meat of this is hugely important to us. It does have a limit of 1,500 characters and spaces. Again, we would ask you to use plain text only. Although this won't be published, sometimes in the download things get pretty muddled if you have too many characters and things in there. So please use plain text. The accreditation requirements, as I mentioned, will need 3 behavioral objectives and 5 references noted. And then presenters at the conference, you can list 5 or more, and then each presenter, we will ask that you use this format to enter their names, title, and organization for all presenters. And then finally, the accept and submit. Yes, we agree to the terms. Any comments? And then you will see we have a validation code. This helps us from getting lots of spam and in our database associated with us. And then you can hit submit. Now, once you hit submit, as I mentioned earlier, you should receive a thank you. If it goes through successfully, you will receive a thank you message. If it does not go through successfully, you can look in this kind of tan beige bar, and it will give you a long laundry list, as you can see, of the things that are still incomplete. Again, this form needs to be completed in one sitting. And let me talk just a little bit about some of the things, troubleshooting things if you are having difficulty submitting your form. What we've run into is with a few institutions or corporations, they have firewalls that may limit the access and data transmission. If this occurs for you, check with your IT department. Sometimes they can give you a workaround for that. Or what we've often found is it's just easier for folks to submit from a home device instead of from their workplace computer. Particularly some of the federal and or state government institutions have those pretty strong firewalls that make this difficult. So if you are an individual who is working with one of those institutions or submitting from there, we'd encourage you to perhaps consider submitting from home. It may make your life a bit easier. Also, network disruptions or problems with internet service provider. Sometimes people will get kicked out of the form midway through if you don't have solid internet. You can try to refresh your web page to see if that data can be restored, but eventually it just might be necessary to close and restart the browser and start all over again. Unfortunately, sometimes that seems to be the only thing that works. As I mentioned earlier, delaying or taking too long to complete the form may cause the system to time out. We highly encourage you to go through the form, gather all of the information, save it in a Word document in text format without the symbols, and then you'll be able to just copy and paste into the form, and you shouldn't run into that problem. And then, I think I jumped ahead. Let me go back. Heavy online traffic also seems to be a kind of ongoing problem. As I mentioned, don't wait until the last minute. And also, you may want to consider not submitting during peak daytime hours, but perhaps in the evening or off hours, and don't wait until that last 3 days. It seems like inevitably we have probably more than 50%, probably closer to 60 or 70% of our submissions. People are trying to get them in the last 2 or 3 days, and it just bogs down our system, and you're very likely to get kicked out. So try to plan to do it a little bit ahead of that March 14th deadline. We talked about scrolling to the top of the submission page for what's missing. All fields with asterisks must have a response. Some fields have data limits. Either edit that content to eliminate the unnecessary words or symbols. And sometimes the math question, if you've timed out, you might need a new math question. So there's a link to get a new math question. And then the other thing, occasionally because of institutional software and again, firewalls, certain browsers don't work for some institutions very well with this form. Try a different browser, either Explorer if you're using Chrome or Firefox, etc. Sometimes that will work. And then when all else fails, you can either contact one of the CFHA staff, preferably our conference manager, Steph Blackstock, or send a message to info@cfha.net, and we can help you problem solve. So again, our deadlines for this are March 14th, and I am at this point going to open it up and see if there are any questions. Doesn't look like I have anyone typing questions at this point. If you do have a question and would like to raise your hand, I'd be happy to unmute you. Stephanie, I'm going to unmute you and see if you have anything you'd like to add or if there's anything that I missed in the presentation.
Hi, this is Stephanie, and one thing I would like to call attention to is when you actually reach the end of the form and you submit your proposal, you'll see a thank you page, and it says, "Thank you, your proposal has been successfully submitted for the CFHA 2016 conference call for presentations." On that page, there is a 7-digit submission number. That's a number that you'll want to make a note of that number, because if ever we have to reference your presentation, if you have that number, it helps us look it up on the back end of the site if we need to. The other thing is on that thank you page, there's a little icon with a printer under the title bar of the page, and it says Print Form Submission. And when you do that, you can print a copy of the information that was submitted in your call for presentation. So it will look very much like the form. It has all of the data fields and the content that you submitted in there. And, you know, I encourage you to keep a copy of that just as a reference that you did, in fact, submit it. That kind of helps us to track it later if perhaps there's a question about who was on your presenter list or what objectives you submitted. You can actually see what was submitted. That's all I have at the moment.
Okay.
Any other questions?
Yeah, thank you, Steph. I appreciate that. Yeah, I'm not seeing anyone raise their hand. Oh, it looks like we have one. Let me see if I can pull this question up. Forgive me. Sandy, I see your question. I'm just having a little bit of difficulty pulling it up. It says, what would you recommend if our project or intervention does not have a complete data analyzed in time for the proposal deadline, but should have a good amount of data in time for the conference? I think, thank you for that question, Sandy. I think that there's an option in the call for presentations. Let me see if I can find the page that calls for evidence, that says it's either a pilot program with rigorous evaluation, or and maybe just in the explanation, if you want to do it's a pilot program, just explain that you're midway through gathering that data. and it'll give us a little bit more to work on. And I think if you particularly describe the methodology for collecting the data and the analysis, that will help provide some meat to the presentation. Any other questions? Okay. If not, I'd like to thank you all for taking the time to attend the webinar today. Feel free, if you do have questions, to contact us at info@cfha.net, and we'll be happy to respond to those inquiries. Oh, it looks like I have one more question. I apologize. Can you describe in more detail the difference between the demonstration and pilot programs? So Susan, I would describe the meat of your either demonstration or pilot program, what you're doing and how you are evaluating that program in that narrative box. I don't have a strong delineator in my description to say which is which, and unfortunately I don't have anyone on from the research committee who can address that. So as you're submitting, I'd encourage you to just describe what you are doing in terms of your program evaluation and analysis.
And this is Stephanie again, to further respond on that. If you look at the call for presentations page and you're reading through the Track 6 description, I encourage you to click on that PDF document that says click here to learn more about the items in Track 6. It does have the contact information for the Research and Evaluation Committee chairs. They're the ones who are really going to be scrutinizing the data that comes from the responses to this question. So if you have a specific question like that, you might want to contact Jody Palaha or Tina Stutz to see if they can answer more succinctly for you.
Thank you, Steph. Okay, guys, thanks to all. Again, please feel free to reach out to us offline if you have further questions, and have a great day and a wonderful weekend. Thank you.